Good morning, ladies and gentlemen. Thank you for joining us. And today with me, I have healthcare activist and cancer survivor Laura Packard, who's here to talk to us about health insurance. Laura, thank you very much for joining us.
Thank you for having me.
Yeah, so you've widely credited healthcare as being one of the things that has saved your life. Can you tell us a little bit about that part of your story?
Well, about 5 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. But I was lucky because I had good insurance through the Affordable Care Act that was able to pay for the 6 months of chemotherapy and month of radiation it took for me to be here in remission today.
Wow, yeah, and if you have any sort of estimate, how much do you imagine you would have been on the hook for financially had you gone into that situation without insurance?
Well, I'm a small business owner, and before the ACA, I had junk insurance. And if I still had that insurance, today I would be bankrupt or dead because it costs hundreds of thousands of dollars to save my life.
And I don't know if you know or not, but Wyoming has one of the highest uninsured rates in the country. Why do you think that is? What it is about Wyoming or this demographic that has gotten them to this point?
Well, Wyoming is one of the 12 states that hasn't expanded Medicaid, and that means that working Wyoming families that make a little bit too much money to get help through Medicaid, but don't make enough money to be able to afford Affordable Care Act policies, can't get health care. So, Wyoming is one of the states that really needs to move forward so that thousands of Wyoming residents can finally get affordable health care.
Gotcha. And correct me if I'm wrong, the Affordable Care Act open enrollment did begin November 1st. Is that correct?
Yes. So if you don't have health insurance, you should go to healthcare.gov. You have until December 15th to sign up for a policy that starts at the beginning of January. But if things are hectic with the holidays, you do have until January 15th to get covered for next year.
Wonderful. Gotcha. Yeah. And so, Laura, for those who might feel like they are unstoppable, who have no pre-existing health conditions, perhaps someone who is young and foolish like myself, what would you say to them to convince them otherwise, to convince them that, yeah, they do need health insurance?
Well, everybody is healthy until they aren't. It could be a car accident or something unexpected, like a bad diagnosis. I mean, I was healthy until I wasn't, and then I was really glad to have that health insurance, that peace of mind.
Yeah. And I've heard that people who aren't insured and then they get themselves into those situations where their health is compromised and they resort to maybe unsafe practices to compensate for that lack. Have you personally seen any horror stories where, someone's done something crazy to try and make up for a lack of health insurance?
Well, I think a lot of the time people just don't go see the doctor because they're afraid of what they might hear, or they might get diagnosed with something and prescribed medications that they can't afford. So you can go to an emergency room and get care, even if you're not insured, but there's still the question of how do you pay for that. And so that's why it's so important. At least go to healthcare.gov and check out your options. Maybe it's going to be cheaper than you might think because the Inflation Reduction Act that was just signed into law a few weeks ago makes insurance policies more affordable than ever. So at least go to healthcare.gov, check out your options.
Well, thank you very much, Laura, for joining with us today. We really appreciate it. It's all the time we have today. Thank you very much for joining us. Laura, thank you.
Thank you.